This is a great question, and I'm going to answer. You're going to hydrate them. Hydration is going to be first, and I want to explain this to you. If that patient has sickle cell anemia and they're in sickle cell crisis, what's happening? Those cells have sickled, they're clumping up, and it's very painful for the patient. But even more important, that oxygen that's being carried in the hemoglobin, that's being carried in the RBC, that's being carried in the blood, is not getting to the tissues where it needs to go. So the problem really isn't the patient not having enough oxygen. They have the oxygen. The oxygen's located in the blood, right? The problem is the blood has sickled up and it's not moving. So when you hydrate the patient, it causes those sickle cells that were clumping up to go back to the disc shape that it was supposed to have, so it can flow freely and go to the tissues where it's supposed to go. It's crazy. Students will try to argue with me in the comment section. I want you to take a look at this. Look at what it says. Oxygen therapy is of little therapeutic value unless the patient has hypoxia. Severe hypoxia must be presented because it causes massive systemic sickling. That can be fatal. Look at this. Oxygen administration is usually not effective in reversing sickling or reducing pain because the oxygen is unable to reach the enmeshed sickled erythrocytes through the clogged vessels. Think about the pathophysiology of what's happening here. The problem is not them not having enough oxygen. They have the oxygen's in the blood. The problem is the blood's not moving and going where it needs to go because those cells have sickled. So what you're going to do is hydrate that patient first. As soon as you hydrate them, those cells are going to go back to the disc shape that it should go to, so the blood can start moving. Then, of course, by all means, give that patient oxygen. But if you have to choose one thing to give to that patient and they're in sickle cell crisis, you're going to want to give them IV fluids and give them oxygen next. Oxygen is great, but the problem is not them having a lack of oxygen.